You're watching Rogers TV, Midland.
Good evening, and welcome to all of you. Thank you for your interest in tonight's program. Be happy. Happy face. My name is Keith Rose, and I am your moderator, and this is our 43rd Our Health event, and this is our 7th year. So for the speakers that are sitting up here, we've had at least 150 other speakers sitting in those chairs, and they survived, so you will too. So great to have you all with us. To the audience, we're pleased to be seeing you watching us at home on Rogers TV or streaming the broadcast live on your electronic device. We do not have an in-house audience tonight in Simcoe County. The risk of community COVID transmission has recently increased. Health services are stretched throughout the entire area. And so our original in-person audience is now watching from the comfort of their home with their feet up. So hi to you at home. It's my pleasure now to introduce tonight's 4 speakers. More detailed biographies are available in the brochure that we sent you online the last couple of it's there. Take a look. On my immediate left here is Nadia Sunderji. We are very much looking forward to hearing some of her music tonight, and she tells me she wants us to participate. Don't be afraid, keep viewing us. She's got a plan for those of us who can't sing. So welcome, Kelly.
Thank you, Keith.
Emily Dampier is a dynamic and very optimistic psychotherapist. She has completed her Master's of Counseling Physiology here in Midland with Chantal Coward and Associates. Emily embraces her Indigenous background. She also paints. She makes jewelry. She does woodworking. In fact, I don't think there's ever a dull moment in Emily's life, in Emily's day. So welcome, Emily.
There's no time for a dull moment.
Phil Edmonds on my far left over there, far right, I guess, far left. Phil is a physiotherapist by training, and I have on my notes here, an expert in assessing and treating a multitude of injuries and ailments. Phil's the guy. Phil has been involved in the Our Health program for over 8 years. But Keith, didn't you just say been going 7 years? Well, Phil was the original host and moderator of the Community Health Series. We just didn't call it Our Health then. And that's about 8 years ago, right?
That's right. That's right, Keith.
Programs, Huff and Puff, back in November 2016. He talked about all the marathons he's won and participated in. And in sports injuries in June 2019, he taught us how to exercise and what to do about the injuries from all the huffing and puffing that they did.
Correct.
So welcome back, Phil.
Good to be back. Thank you, Keith.
Okay. Before we begin, I have some collective thank yous to the Our Health Advisory Committee, specifically to Laureen Hilderly, who helped me endlessly organize and prepare for this program. I want to thank our 7 local sponsors, and I'll have something more to say towards the end of the program about our sponsors. but I am remiss if I don't say something about the wonderful volunteers at the MCC, the promotions director, Michelle Thibodeau, and Glenn, who's upstairs in the box, who's looking after all our AV setup, and Josh. How can I forget Josh up there in the box? Josh is from Rogers TV. He's the guy that's responsible for what you look at tonight. And so thanks to all of those people for what you do for the Our Health program. I'm going to clap. It's 90 minutes long. We'll be together. I will engage in a discussion with the speakers like I always do, and we'll be talking about happiness, both from a professional and a personal perspective. Included in our discussions will be some of the questions that people have sent to me in advance, so we may not have a formal question and answer period. And I'm looking forward to hearing their stories. The organization of this program was different than any program that we've had before, because we not only had to have the criteria that they'd be a good speaker, they'd be fun to listen to, that they would be calm and relaxed, we had to make sure that they were optimistic. So we added that to our criteria. So please listen to them, and please join us as Natalie takes it away. Except I'm going to change this again. Sorry, just a little something different for tonight. I'm going to ask the speakers to talk about the definition of happiness and some of the things that happen. Important in looking at that definition. So, Nadia, why don't you take it away and give it a shot at what you think happiness is, and then I'll get the others to join in.
Sure. Yeah, I'm happy to start, and you'll find that when I get into a little bit more of my talk, I'm going to really focus on the science of happiness. So let's start with kind of a scientific definition of happiness. And there are many philosophies of happiness, but the scientists tend to focus on a concept called subjective well-being, which is really about a combination of feeling satisfied with your life and feeling positive emotions. And it's close to feeling that your life has meaning, but it's not exactly the same as that. And it's not about feeling completely joyful and fulfilled every moment and kind of feeling like all your needs are met. It's, in fact, includes a mindful acceptance of difficult situations, of difficult emotions as well.
Okay, thank you. Thank you. Phil, you're the guy that sees a fair amount of pain, right?
Absolutely.
Okay. So, do you need pain and hurt as far as your psyche is concerned when you're thinking about happiness as a comparator?
Well, I think, we often talk about avoiding stress or managing stress, but stress can also be a good thing, whether it's physical stress to become stronger, to overcome some injuries, or even attain a certain goal. The same goes with mental stress too, making your brain stronger, studying for exams, those types of things. I don't view stress as something I try to stay away from. I embrace it, I engage it. I know I'm going to be put under stress every single day, whether it's at home or in the work environment or in the gym. And I just deal with it. I know I just have to keep moving. It's going to be okay. And that's what I say to my patients, my staff. It's going to be okay.
Okay, thanks. Thanks. Emily, do you think your level of happiness is explained by the environment that you're in when you're assessing your level of happiness, or is it more just something ingrained in your personality?
I think it can be a little bit of both, right? The way you experience things. If you put yourself in a good situation or a good place, then you're going to have those good experiences. But it's also, like Phil was saying, the mindset, right? If you have that personality, if you want to be happy, you can have that control over your own happiness. You can put yourself in those good situations. You can take yourself out of those maybe not so good situations. So I think it's a good balance of both.
Okay, thank you. Thank you. Do you think, Kelly, do you think happiness is seasonal? Like, are we happier in the summer when it's hot, or in the spring and the fall when it's nice and everything's beautiful outside, or in the winter when it's cold? What do you think?
Oh, that's such a good question. I mean, I definitely feel like the weather outside does impact my my mood on a day-to-day. So I think there is something to say there. But for kind of long-lasting, I don't know. I don't think so. That being said, I know something exists called seasonal, oh, Dr. Sunderji, please help me, seasonal affective disorder, right? Mm-hmm. So I do believe the weather outside does impact us, and we live in such an environment and a climate here in this area where we get pretty wide range in the seasons. Yeah.
It's referred to as SAD, S-A-D.
Right.
Yeah, no,
Maddie?
you got it exactly right. Seasonal affective disorder, and a subset of people experience that, but I mean, lots of people to different degrees, right? Yeah, I know since I moved up here, I have much more appreciation for all of the seasons because of exactly what you were saying about just the weather.
Yeah.
Do you think our appreciation of happiness changes as we age and move through the different stages? So I was reading something that said, in your teens, fun is excitement. You know, the risk stuff, the loud music, it's excitement. Get a little bit older, and then it's about, well, what level am I at in my job? Can I be the manager? Can I be the boss? Can I take home a big paycheck? Can I buy a big car? And then when you get to my age, happiness is getting out of bed in the morning, right? So that's the way I feel about it. How does that affect the rest of you? What do you think?
Well, my mother's 92,
Uh-huh.
and I speak with her every week, and I've noticed over the years is just the focus that she has now in life compared to maybe 40 years ago when, you know, we were all active and things were very stressful in life, and not that they're not, but her focus now is she will tell me the good things that happened to her that day, and she focuses on that, and that is it's a very easy conversation to have with my mother. And that doesn't always happen, but I appreciate it because I have very stressful days, and it's nice to be able to focus with her on those small things that keep her happy during the day.
So when you have a psychotherapy visit with somebody, Emily, based on their age, do you approach it differently sometimes? How do you manage that?
Again, I think my biggest thing is experience, right? Like if you've experienced something, someone who's much older than, you know, like an 80-year-old client versus a 12-year-old client, well, that 80-year-old client is going to have a lot more experience in a lot more different fields. So the way that maybe we approach happiness or the way that we can appreciate happiness, I think is going to be a lot different than the way that I would work with a 12-year-old, for example, and how we would look at happiness and how to foster that happiness as well.
Okay. So I loved your definition, Nadia, but in this conversation, I think we're seeing that happiness can be many things, and influenced by many things. And for each of us, it's kind of individual sometimes, too. So thanks for weighing in on that. The one final question on happiness is does that, if you're happy, does that mean you have better physical health, a better immune system, and perhaps a longer life? Now, you were going to get into the science. Does this broach on that question?
It does. It
Okay,
does.
can we
You want-
steal from-
you want
can
the
we
bottom
steal
line?
from her?
Sure, yeah, absolutely. So happier people do have better physical health, including heart health and chronic pain. They also have better mental health, including less worry and less sadness. They have better kind of social lives in terms of stable relationships, less loneliness, more success at work. And actually, it has been shown that happier people live longer, in the range of 2 to 7 years longer, actually, depending on when you measure.
Okay. Well, this group's willing to come back 40 years from now because they're all going to be here. They're all happy, right, Phil? Okay.
Absolutely.
Phil, in the people that you interact with, because does their state of happiness reflect on how much exercise or how much they pay attention to your instructions on their physiotherapy?
Yeah, 100%, Keith, and it takes effort to kind of direct them towards. Sometimes I use the objectivity of their advancements and show them that things are moving in the right direction and have them focus on maybe more objective findings with their injuries to show them there's positivity, there's movement in a positive direction, and stay away from that pain-focused behavior that might drag them down and inhibit them from those milestones that they need to make.
Okay, thank you, thank you. Nadia, tell us how you embrace happiness when you're at work and when you're at home, and what work you're doing with your staff at Waypoint to help them embrace happiness a little.
Yeah, thanks. Well, let me start by saying, despite being up here and doing my best to field your questions, Keith, I do not consider myself to be an expert on happiness personally or professionally. But I'm really happy to share with our audience some of the things that I've been learning about as I have been turning my mind to what are research-tested practices that I can personally implement and that Waypoint can implement that will really, spread joy for each of us. And again, sort of bottom line up front, there's science that shows that individual people can change things in their lives, to Emily's earlier point, that can increase their happiness, and also employers and leaders can change things in the way we do our work that can make our workplaces happier. So I am going to start with a personal story about kind of something that was going on for me that, kind of kicked me off on this journey. It was sort of a time when things snapped into focus for me, shall we say. And I'm going to take you back to last summer, so the summer of 2021, and we were already a little over a year into the pandemic. And, all around me, staff and leaders had been just, sprinting to keep up with all of the changes that needed to happen. And the challenge last summer was that the sprint had really turned into a marathon, right? And around that time, we learned that our amazing president and CEO, Carol Lambie, was going to be retiring. And a couple of trusted colleagues encouraged me to apply for the position. And we said, absolutely no way, not interested. I would not even have I just shut it down, which is funny, right? So, with the benefit of a little bit of time, rest, reflection, time with loved ones over the summer, I came to realize that it was really my burnout that was saying no. And, that unfortunately all too prevalent state of emotional exhaustion and disengagement and just, reduced effectiveness. And I'm really fortunate that I had, very caring, thoughtful colleagues and family members who really kind of helped to see me through that time and reconnect with my core values and essentially helped me to rewrite the story I was telling myself at that moment in time. And I, looked back to things that I had saved, like cards from former patients and even from my medical leadership team at Waypoint that just also helped me to kind of revise the narrative. And really where I came to was realizing that I was too young to retire. I was not close enough to be able to limp to the finish line like many other wounded, but still well enough to work healthcare workers. And something had to change, and if I could change something not only for me, but also in a way that would, spread a happier, more resilient feeling among the amazing people that I work with who are showing up day after day, and just help get us back to that, healing, caring place of compassion for patients and families and for ourselves, that would be really meaningful to me. And so fast forward, here I am now.
So I would like to know about your happiness scale in this little journey. So I'm going to be kind of pointed here. So as part of getting a new job, you have to appear in front of a search committee and you prepare all these notes and you have to convince them that you really want the job. And
I didn't tell them this story, as you can imagine.
So you come out of that interview and you're kind of thinking, oh, so what was your happiness level there? And then somebody actually announces that you are the chosen candidate. So what's your happiness level there? And then after your first day on the job, where's your happiness level there? So in those three scenarios, have you been up and down, or has it been just smooth?
I think that's really interesting. I think the process was an opportunity to further reflect on my vision and, what I would bring and kind of affirm the rightness of the path that I was starting down. I mean, certainly I was nervous and, there was relief when each step was over, but but I was, really excited when I heard the news. And from day one on, it's just been a blast. Like it's my energy and excitement and inspiration have all just gone way up. And to be honest, a lot of that is from spending time with, our staff and to some extent our patients as well, and just reconnecting to purpose and what we're doing together.
Okay, well, I interrupted your story a little, but please carry on.
Yeah, no worries. So, where was I? Oh yeah, so starting. So really kind of what I want to share with you is a bit about what I've been learning as I delve into, what is the evidence around happiness and how can I apply that at work. So, and really an important part to consider is that the drivers of burnout are systemic, right? And they're not, even though it's felt very much personally like we can't yoga our way out of this, we have to, come up with some organizational solutions as well. Although I will just mention that as far as, individual care and resiliency solutions, we have our frontline wellness program that I just want to take a moment to kind of share with people that Waypoint, along with 4 other hospitals, have been delivering assessment, navigation, and where appropriate brief psychotherapies for healthcare workers, broadly defined throughout the pandemic, including first responders, including managers and leaders, and it's freely available and people can self-refer. So I just kind of want to mention that, the individual solutions are important as well, but I was really interested in looking at what are the upstream, solutions that will prevent some of that burnout in the first place, and that's probably my public health background speaking as well. So we talked a bit about the definition of happiness. What others said really resonated with me around, there's apparently like 50% of our happiness is actually genetic, and then only 10% is really driven by life circumstances, which surprised me. And then the 40% is what you were saying about that kind of, intentional practices that we can change that really bring happiness into our lives. And, those include experiencing awe and a sense of wonder, empathy and compassion, gratitude, forgiveness, mindfulness. I'm sure others will talk about that as well. And kindness and connecting with others and connecting with our purpose is something I've talked about as well, because I think it is related. We talked about some of the benefits already. And really, I think where I want to go with this is actually to share with people some of the practical things that I tried as I started to take some courses from the Greater Good Science Center at UC Berkeley, and just invite you to consider if you want, to try something along these lines yourself.
So tell me how you found those.
Yeah. How I found the course?
How you found the course, yeah.
Well,
I found this one a little, so I'm going to share it.
So yeah, my partner was taking the course. My partner, Scott, took, I think, 2 or 3 of their courses. They're freely available online through the edX platform. And he's like a pretty happy, resilient guy, even like at baseline. Anyway, but I did notice over the space of a few months, like some, subtle but meaningful shifts. And it just got me curious about, what he was drinking in online, and so popped into it myself, and it turned out to be really compelling in terms of the evidence, but also really practical to implement in the day-to-day. So I tried a bunch of different things. Some of them felt really natural to me. Some of them didn't. Some felt like they really made a difference, some less so. And I just think like people have to try different things and see what works. But I can talk us through a few of them if
Sure, please do.
that works. Yeah. So one of them is spending time savoring the positive things that happen, and this concept of 3 good things. So like every day, at the end of the day, taking a moment to just reflect on like 3 good things, that happened, and take a moment to give it a title and what exactly happened, and how did you feel, and how do you feel now, and what caused it, and just like really kind of immersing yourself in that. It teaches us to kind of find the positive no matter what kind of day it. Another is active listening, and it's really about, taking a few minutes in the week to really focus your attention on another person in an intentional way. Listen, not interrupt, paraphrase and ask questions to make sure you understand, try not to judge, and kind of really devoting your attention in that way, can be especially helpful with difficult conversations, but also makes people feel understood and supported and strengthens our relationships. I almost skipped this practice because I think I'm pretty good at this, but then I thought, Scott actually would probably not agree with me. So anyway, so it's worth trying. Random acts of kindness. So doing 5 kind things that you wouldn't normally do in one day. Could be for different people. They don't even necessarily need to know that you did it. And then taking time later to reflect on those actions and how they felt. And so kind of really bringing, and the neat thing about that one is there's all these ripple effects, right? When people do realize that they have been the recipient of your kindness, or when they witness you doing that kindness, it elevates everybody, right? Brings energy, inspiration.
So all of you, I think, have heard of the random acts of kindness. I think there's some papers out on it. So it's pretty easy to follow. Tell me about a random act of kindness that each one of you have done in the last 24.
I don't think it has to be this big extravagant thing. Like, it doesn't have to be, you're paying for someone's meal, or you're going and buying someone something. Like, it doesn't have to be so big. It can be something as small as, cleaning up the kitchen, or, the dogs haven't been fed yet, so go feed the dogs, and just helping the other people out. I think that's the concept, is no matter how big or small, you're trying to give some trying to help someone out in a way that doesn't even have to be noticed. It's just something that's nice to be done.
Phil, what about you?
I agree. It can be the simplest thing. We're having lunch in the staff room, and you look over at a staff member, and we have a lot of fun, and you say, hey, you got a bit of food right there. You could let that go and let them be embarrassed, but it's just nice to help a person out.
Making the connection.
Absolutely.
Mm-hmm.
Kelly, how about you? Maybe yours aren't random. Maybe yours are chosen.
Or chosen, yeah. Actually, I think I do agree with what you were saying, Emily, just the idea of it I just thought of things around the house, something my husband usually does for me, and so I tried to return the favor over the weekend. So just yeah, it's a small thing, but doing it with that intention of kindness.
Okay.
Yeah.
Okay. We keep interrupting you, Natalie.
No, it's,
Nadia, sorry.
it's great. It's a great discussion. I'm excited for how we're going to keep building on each other. So a few more. So another one is mindfulness, meditation. And there's lots of different ways to do that. There's sitting and breathing meditations. There's yoga. There's body scans. There's loving kindness meditation. And, that doesn't come naturally for a lot of people. But trying and seeing if there's a way that works for you. And really, mindfulness is about being fully present and immersed in the moment. And the science actually shows us that like half the time our minds are wandering, and that makes us less happy, even if we're thinking about neutral or positive things. And the other component of mindfulness is really about accepting without judgment the experience in that moment. And so those two elements.
So you've done, actually, I think at Waypoint have done some stuff online that's available for people. We had an event probably, I don't know, 2.5 years ago. Nicole Mace from Waypoint came down, and she did this mindfulness on everybody in the audience, and I thought, yeah, but I got to pay attention to the time. I'm not going to do this. But I did, and I found it. Actually, it really worked. Now, have I done it since? Well, that's another conversation, but it does work well.
It's tough to sustain,
Yeah.
but we are actually, that group is ongoing, and also freely available to anyone in our community. It's only just a few weeks, so it is a nice kind of way to begin. And other folks at Waypoint did some research on that, and actually 130 healthcare workers who participated in that mindfulness group and in the study had less emotional exhaustion and more resilience, and that was maintained even a month later. So it is a really powerful practice, if not entirely intuitive for most. Being grateful is another, taking a few minutes once a week to write down like 5 things that you're grateful for, and doing that for 10 weeks is actually very, very powerful. That's one I have found like relatively easy to kind of sustain. And then lastly, spending time in nature, or doing something else that evokes a sense of like awe or being surrounded by beauty or something spiritual. Like it really taps into humility and a sense of openness and curiosity and being a part of something kind of bigger than ourselves. So all of those are, scientifically proven to increase happiness, but also in many cases, optimism, compassion, generosity, and lots of other kind of good things all come along with that.
So I don't think anybody would disagree with any of the comments that you've made. It's great to hear them. But I think they'll say, well, Natty's a really busy person, and I'm really busy. How do you possibly fit all that in or make sure it comes to the top of the priority list for the day?
It does.
Because there are other things. The dog needs to be fed. You have a paper that needs to be finished. Somebody's waiting for you to talk to them. I mean, there are other things that fill your day. So how do you prioritize it?
Yeah, I mean, you'll notice some of the things I mentioned actually don't take a lot of time, right? It's a practice of a few minutes in a day or in a week. Some of them can be done while you're walking the dog, and you can be thinking about, those 3 good things or the gratitude. So, and for me, I think, I've discovered like where I feel most mindful is actually when I'm doing my like workout and lifting weights, or, the nature part is the part that goes with walking the dog, and, reflecting on progress at the end of the day is like me picking up my knitting needles for, a few minutes. So it fits. And for me, a bunch of it, because, work is a big part of life, at least right now, like is about introducing some of these practices into the workplace. So I'm happy to chat about that as well, but I just want to I know there's been a lot, so if people take away one thing, I want them to think about the acronym PERK. So if you perk at work, it's about purpose, engagement, resilience, and kindness. And we're kind of gradually trying to start to introduce some practices that capture those.
It's neat. It's neat. I wondered the thought that one of your jobs is to make sure that patients have really good care, right? And if you go into work and you've had an argument with your partner, you kicked the dog on the way out the door, you ran into something as you were in the parking lot, what chance do you have of giving really good patient care? Whereas somebody that comes in has had a positive experience with a partner or a friend who's thought about what they're grateful for, smiled a couple of times. It's just a different world, isn't it? And is that what you're really working on? Is that the kind of thing, or am I?
Well, in a way, so yes and no. I would say there is absolutely a very strong business case to invest in reducing burnout in healthcare environments. Decreased turnover, decreased sick days, better quality of care, all of that. And I think my only hesitation is all of that is true, and I also want to emphasize that, like, it as an end in itself, us, being well in our workplace also, is okay as a goal. Like, it doesn't have to be just because it does also have all those other proven benefits too. So I think both are true. Yeah.
I was at another hospital, elsewhere hospital, and they had signs up all over. It just said, "Be kind." Big signs everywhere. And I thought, you know what? That's not a bad message. I mean, no matter who reads that sign, it's going to be helpful in some kind of way. And was constantly in your face everywhere. So just a different approach to maybe achieve something that we all want to achieve. So thank you. Have you got more to talk about? Because you're welcome to carry on.
Well, thanks. I'm going to wrap it up soon because I really want to hear from everyone else too. But I'll maybe just briefly explain a little bit about PERC. So just back to that kind of acronym and just explain it a little bit. And an example of something we've started at Waypoint that, again, is like pretty easy actually to work in. So purpose is really about, our work aligning with our personal values. And at its best, it's really a sense of calling. And in our workplace, we really try to, talk about our core values and embed them in communications and even in kind of routine processes like recruitment. And we're about to have our core values celebration. And it's great to see people uplifting and celebrating the way that, folks are embodying those ideals, those shared ideals. The engagement piece in this context really refers to enjoying our work, having a sense of autonomy, having times where we experience curiosity, and also flow. And flow is like these really rare, precious states of being so completely immersed in something that you almost lose track of time. And that feels very rare these days and very precious. And so, reducing distractions, celebrating progress, doing creative problem solving, doing that with other people, all of those things really add to our joy in work. And we did some of that in a leadership retreat recently with our directors this fall. The resilience piece comes back to mindfulness, but also things like being compassionate to yourself, expressing yourself authentically, and also taking time away from work, which is something a lot of people kind of went without in the early stages of the pandemic, and we're really kind of seeing the consequences of that now. And then lastly, the kindness piece is about, civility and respect, and also building inclusive workplaces. So just one last thing I want to mention is in the last few months, we started something at Waypoint called Thank You Thursday. And it's just a really easy way for people to recognize each other for something awesome they did, and they can send it to an email called Thank You at Waypoint, and we shout them out in the bulletin. I do like a video once a month and just kind of send people a message about like great stuff that's happening here. And it's in that sweet spot, I think, of like easy to do, but also really meaningful, not only for the person who's being thanked, but also the person who's doing the thanking and everyone else who gets to hear that, uplifting story. So I've been thrilled at like how well that's really taken off, and it just gives me further optimism that we can kind of, make small changes that can have ripple effects across the hospital. So maybe I'll leave things there, but I'm just really so excited to be with this amazing group, and I can't wait to hear from everyone.
Great. Thank you. Let's clap.
Excellent.
Kelly's got this all planned out, so I should shut up and Kelly should take over. Good. Go ahead, Kelly.
Well, when my colleague Lorene Hilderly invited me to be a part of this talk today, I was like, yes, absolutely. I'm so passionate about talking to folks about the relationship between music and our health. And with the topic today, Be Happy, I thought I have to include music itself in my portion of the presentation, because for me, music and happiness are very interconnected. So I'll just start with a bit of music for everyone.
Now tell me, TV audience, online audience, don't you feel better for hearing that? Thank you.
Oh, thank you so much. So yes, in my work as a music therapist, I support people using music primarily within a therapeutic relationship. And we look at health and music within kind of 6 different domains. So we have physical, social, cognitive, emotional, spiritual, and communicative. So I'm curious to ask you, as you heard me play that fiddle tune, did you notice anything change with your physical self? Mm-hmm. Did you move your body a little bit? Did your toes tap?
I saw Phil's toes tapping.
I think I saw them at the
Absolutely.
corner of my eye, too.
If you played any longer, I was going to be clapping. So to the music, maybe to the music.
So yeah, I mean, music and our physical selves are so intrinsically connected, and that has a lot to do with rhythm. Maybe on the emotional side, I'm curious if your mood shifted, and Keith, you mentioned that as soon as I finished playing as well. So that's definitely something in music therapy we look at a lot, is the impact of music on mood and on emotion. From the communication side, the song that I presented had no lyrics, had no words, but I don't know if you felt that I communicated something. Certainly I had an intention behind the piece that I prepared based on the theme of today's talk. So that's something that I find so special in the work that I do, is it's a nonverbal form of communication. That can be pretty important for some of the people that I support. Cognitive. This is a big, big topic in music therapy, and especially in the more recent research, last 30 years or so, about music and the brain. But one of the things I wanted to ask is, did this music evoke any memories for you? Because music and memory are very interconnected as well. So maybe as I played this fiddle piece, you thought of someone you know, or an event in your life, a place you visited. Social. Now, I know we are kind of playing for an audience at home, but music for me on a personal level has always been something that connects me to others. So growing up, I was very much encouraged by my parents to play music in the home, and I actually have a family band. I play music with my 2 sisters and with my parents. And the other part of that social element is we actually are playing music from our culture. So I'm Franco-Ontarian, so we play a lot of music in French, a lot of fiddle music, such as the piece that I played. And so it's a part of our keeping our cultural traditions alive. And that's something very special about music from all over the world. Almost every world culture, I don't think there's been one that's been found that doesn't have a music tradition that is connected with cultural practices, dance, rituals, even spirituality as well. So today, really, my goal was to share a little bit about how you might think about incorporating music in your day-to-day. So I loved hearing a little bit about what you had to say, Dr. Sundarji, and hopefully this can kind of add to it. So just things for you to consider as you listen to music. So I'm sure a lot of you do enjoy listening to music, and probably do on a daily basis, because music is kind of all around us. And one thing I would invite you to do is try to think about it a little bit more intentionally. Really take the time to pick out the music that you listen to, and think a little bit about why you're listening to it. So for example, as I was saying earlier, music can impact our mood. It actually has a lot of things that it can do. But using technology that we have access to today, for example, if you think about YouTube, Spotify, Apple Music, all these music streaming services, we can actually begin to create playlists based on what we want music to do for us today.
So some of our audience is older than you and I.
Fair
Can
enough.
you tell us what playlists are?
A playlist. Okay, so back in the 80s, they called them mixtapes. I don't know if that helps to put a little bit of context. But basically, a playlist would be to select, again, with intention, a selection of songs that you would then play kind of one after the other. So you might choose a selection of songs that for you notice they make you feel maybe more calm or more relaxed. And that's something you could use on a day that you found a little bit more stressful, or if you're feeling a bit anxious, or you've had a busy day and you just want to kind of settle down for the day. We know that music can actually slow down your heart rate and slow down your breathing. And when that happens, you're actually telling your body you're in a place of safety, a sense of safety. And the other part of that is if you're picking music that you know and that you love, that's also going to give you a sense of safety because you know what's coming, you know what you're about to hear. The last piece, if you're looking for music to calm you down, has to do with tempo. And this is a bit more technical, but tempo essentially is the speed of the music. So research has shown that a slower tempo that kind of matches a resting heart rate, around 60 beats per minute, really can help with generating a feeling of calm and of relaxation. So I'm just going to play a little bit of guitar at a slower tempo, and I want you to feel kind of what that feels like for you. That was maybe around a resting heart rate. So just to give you an idea, so imagine listening intentionally to music for 20 to 30 minutes at that speed. All of a sudden, you might notice a shift in your mood and feeling more relaxed and more calm. Certainly, that's something that I notice with the folks that I support. On the flip side, you can use music for motivation. And I know a little bit later, Phil, you may talk about physical exercise. There's actually been quite a bit of research on music and athletes or people who are exercising, and using music can actually enhance physical performance, believe it or not. If you're listening to music, it helps with like making your heart more efficient, again, with the breathing as well. So if you're using music for motivation, it doesn't have to be only for exercise. I mean, I use it at home around the house when I'm doing tasks that I don't really feel like doing, maybe the dishes or the laundry. If I put music that kind of pumps me up, that motivates me, I find that really helps me to stay focused and stay kind of positive, stay happy, I guess, doing it instead of grumbling. So
tell us, you've talked about tempo and
Yeah.
kind of music. What about the volume of the music, or is that an age thing?
Oh, that's a great question. Volume of music. So yes, listening to music very loudly could create damage to your eardrums. So do be careful about volume, especially if you're listening to music while you're doing a task that's kind of loud. But I would say for the most part, it's around personal preference. Sometimes really loud volumes can be overstimulating, and I do see that in my work, so I try to be as mindful as I can. So I would say listen to yourself when it comes to volume. That would be my 2 cents.
So, Phil, Kelly brought up the issue of exercise. So you crank it up when you're the volume up?
Absolutely.
You do?
Absolutely. Okay. In the gym I go to, we have the music blasting during the specific workout portion of the time we're there, and absolutely it's motivating, and it's high energy music, and it pumps you up. Yeah.
Well, that was the other piece I wanted to share, is that the idea you say high energy, again, this technical term of tempo or the speed. So when you're thinking about music for motivation, you're actually going to stay away from those slower speeds, most likely, and you're going to speed it up a little bit. So I'll show you what that would sound like now.
Can you lift iron to that, Phil?
Yes.
A little bit probably with more efficacy maybe than the first example that I shared, right?
Agreed.
So something about tempo and rhythm, because all of us do have a very rhythmic body, if you think of our heartbeat, the way we move in the world. So those are things to consider. The last thing I will say, this is kind of deviating a little bit from the theme of happiness, but listening to music that reflects your emotion, no matter what it would be, like any emotional state, sadness, feeling frustrated, feeling grief, feeling anger, listening to music that reflects where you're at in the moment is also very beneficial. So I don't want to say you have to always listen to happy music and that's the most effective way to achieve health. It actually is very effective and kind of cathartic to listen to music that reflects the way you're feeling in the moment. And I do see that a lot in my work as well. The only thing I would say for you to consider is give yourself the time. Let's say you're having a down day, you're feeling sad. Give yourself 10 or 15 minutes, a few real sad power ballads or whatever it might be. Let yourself dig into that, but maybe over time modulate the music. And what I mean by that is you can start in that maybe darker place, but maybe over time, try to pick songs that reflect kind of where you want the rest of your day to be. And that's something called the ISO principle. We use that a lot in music therapy sessions. Thank you so much for listening. To finish off kind of my portion of the chat today, I wanted to finish off with a bit of singing. Singing is something I absolutely love and I'm very, very passionate about. I really enjoy doing it, and I think there's probably a lot of scientific reasons for that. Believe it or not, singing does boost your immune system, and singing in groups has also been proven to decrease feelings of loneliness and even depression. And again, when you sing, it's actually having to slow down your breathing because your inhale happens a lot faster because as you exhale, you're producing sound as you vocalize. So I invite for those of you at home to please do try this practice, a little bit of singing together. If you feel comfortable, you can just hum if you prefer. I'm going to be saying oohs, so if you feel comfortable with oohs, but you can do whatever you want. If you're not so much of a singer, that's okay too. You can just do some deep breathing along with the music and try to exhale as I am singing and inhale with me as I inhale. All right. Thank you.
Love it, Kelly. Thank you very much. We're so appreciative of how you put yourself into this a whole lot.
Appreciate it.
I have a couple questions before I'm going to let you off, though.
Sure, of course.
You're making music, and we're listening to the music. Mm-hmm. Does it make a difference? How do you learn to appreciate it? And do you listen to people's music, and is it totally different? Or what do you do?
Yes. Do you mean like how it will impact the person listening versus the person playing?
Correct.
Yeah. Yes, there's benefits to both. I definitely would advocate for people who are interested in engaging in music, at the very least, thinking about the intentional listening. But if you're also, maybe you've always wanted to pick up an instrument, there are so many benefits to singing, playing a musical instrument, even like with like your cognition over time with aging. They are finding some pretty like interesting stuff about how music can strengthen our brains, strengthen our memory, our cognitive capacity in general. So that's a huge benefit. And the other benefit for me that I find, again, I mentioned the social component, playing music with other folks, like that just, it connects me with people. I've made friends that way, connects me with my family. So that kind of, it's just this extra bonus when you're actually doing it yourself. And then for me, it's also that emotional release that I mean, I get it every day. It's part of my job. I'm able to do it. Of course, when I'm with clients, I'm supporting them. But when I can, I also practice it for myself. And that emotional release is something that has helped me immensely with my health. Yeah.
Great.
Thank you for asking.
Great. Yeah. So if a parent comes up and says, you know, I'd really like my child to enjoy music, a musical instrument.
Yeah.
But my parents made me take piano, and they made me practice every day, and I hate it now, and I never even look at it.
Yeah.
So how do you get there to the place you want to be versus what happened to the parent?
Yeah, it's tricky with music because when it comes to playing a musical instrument, it does require a fair amount of time and discipline, effort, perseverance, a lot of things. And for some people, they've had negative experiences with that, and that's very valid. I think I would encourage parents, if you do want your child to play music, to try to have a conversation with maybe their instructor, their teacher around the music that they like, because I think the child will have a lot more kind of fun or be a lot more engaged if they're playing music that they actually relate to and connect with. I have taught music prior to becoming a music therapist. I was teaching quite a bit, and that's something that I think is so important, is that you're actually learning something you want to learn as opposed to being kind of imposed in terms of the repertoire. But no matter what, it is a lot of hard work and dedication. I won't sugarcoat that part of it.
Well, whatever your parents did to get you engaged, it obviously worked very well.
Yes, I'm very grateful for both of them. Very grateful.
Emily, thanks very much again.
Yeah.
Thank you. Thank you.
Emily the artist. So is art going to be similar to music in terms of therapy?
Yeah, I was thinking about it when you were talking about it, and I like to think of it more generally as creative therapies, because that could include music, it can include art, play. There's so many different types that you can include in that, and I like to look at it in a more general sense like that. But art has so many similar benefits, and earlier you brought up the aspect of flow, and flow is just my favorite topic. I could talk all day about that. And maybe I'll get into it in a little bit, but using that art, that the way that you produce the art, the mediums that you use, the reasons behind creating that art, the environment, there's so many different aspects that go into it. But as a whole, I'd like to say that the use of art and art therapy techniques, creative therapy techniques, it's just a different level of healing and a different level of creating, a different level of presenting yourself. Yeah.
Great. Carry on with your conversation with us about art.
Yeah.
And culture.
Yeah. In terms of happiness, in my profession as a psychotherapist, I could go all day about what it means and how you can foster happiness. It's such a huge topic, but there's a couple points that stand out to me when I'm working with clients, and then also going into my personal life. Like I mentioned earlier, the connection and experience. So first off, with experience, just with art, with music, with play, experiencing that thing can have so many different benefits, whether it's a physical benefit to your heart rate, or a mental benefit to going into this state of flow where you're so focused that you're grounded. Having that experience of what you're doing. I like to tell my clients sometimes when we're talking about happiness, it's not the paintbrush that makes me happy, it's the experience of painting with it. It's not the paint itself that makes me happy, it's the visual experience I have from looking at it that makes me happy. And I think that goes on to another topic of the definition of happiness. It's so subjective in so many ways. You can look at it in so many ways. But
you brought it up. I have a corollary to that question. So you're creative and you're painting away, and you step back and you look at it and say, color isn't right, texture's too thick, I made it too small, I should have done it bigger. What do you do with that piece of art? Or do you just paint over it? What do you do?
Depends on the day. Sometimes I'll just paint over it, and it really depends. But I like to do this style of art. I think a more technical term is pointillism. But the way I look at it, it's my way of integrating my culture and learning about my culture. When I was growing up, I was involved in my Indigenous culture and did, dancing at powwows and, family gatherings, all that kind of stuff. But the more creative side, I wasn't involved in beading, and beading was something I just think it's just so beautiful, right? So
Have anything on that you've beaded? Yes.
not myself, but a friend of mine have beaded these earrings. I don't know if you can zoom in, but he told me I had to kind of dial it back and not wear dangly earrings, so I did my best. But yeah, just the like I wasn't able to. I just never learned how to do it. So my way of painting is creating little dots to make it look like beading, right? So that takes a very, very long time. I worked on one that was quite large, and it took me over a year to do with school and work and everything. So I would never paint over something like that. I would make sure that I fix it. But I was also thinking about this concept earlier today too, because I recently got some more beads for beading. And I need to learn a little bit more about this concept, but it's the concept of the spirit bead. And the spirit bead is sometimes, a bead might look ugly in the artwork that you're doing, or, you mess up a dot and it looks a little wonky. But it's a reminder that, not everything's perfect, that we're human, and it's something special for us to be able to create this large piece of art, for example. But human mistake and human error allows us to learn. And I think that's a really great part about the art too, is that it doesn't have to be perfect. You don't have to be a good artist. You're not a good artist, you're just an artist, right? Yeah, so I can go on and on all day about art if you wanted me to, but just cut me off there because it'll go a long time.
Well, it's interesting. I was talking to somebody from Quest Gallery the other day, and I accused them of stealing our thoughts in terms of a show they have coming up, which is called, it's a gallery, Happiest Memories. So do you paint your happy memories, or can you do that?
Yeah, that's a really great question. With art therapies and art therapy techniques, we can use different mediums. I'll use painting as my examples, but it can be this avenue of expressing emotion that sometimes you can't verbally express, or sometimes you can't even pinpoint in your brain. You can't really pull it out of yourself. And that artistic expression, it can help us put those emotions on a painting, sometimes with intention and sometimes without. Often with art therapies, we can use it to help people express and evaluate what they've painted to understand what they're really feeling on the inside. One of my favorite activities that sometimes I do with myself, but I've seen done especially with youth, is using your opposite hand to draw squiggles on the paper. You can cover your eyes, you can just go crazy, and then using your dominant hand to draw what you see. So it's kind of like those ink blot tests where you see, what do you see in this picture? Well, it's up to your own interpretation. You draw what you see, you fill it in, and then it's up to you to kind of have that mindfulness practice to see, what is going on really? My unconscious is coming out through my hand, onto this paper, onto this canvas. So how can I use that kind of as a director of how I'm feeling? Yeah.
Are all psychotherapists as optimistic as you are? I met Emily at a local restaurant a while ago, and she said, "I'm sorry I didn't get back to you. My house burned down last week, and my computer's been out of commission." And I thought, my house burned down, and I wouldn't be at the restaurant. but Kelly was there with a smile on her face, and she was getting things back on. How do you do that? What do you put that in? Is it you were born that way? Is it because of your indigenous background? What do you think?
Another big question. It was a very not nice thing to go through, of course, just to put it in very latent terms, but it's been hard, and I think that's okay to recognize is that it's been very difficult, and I've been experiencing emotions and feelings that I haven't felt for a very long time, or things that I've never felt before. But that's okay. And I think what I wanted to convey today is that happiness is a beautiful thing, and happiness for ourselves is ever changing and ever evolving, the way we experience it, the way we see it. But like I think I said earlier, you can't have happiness without sadness, without anger, without stress even, right? These emotions, they all work together and play together. We're holistic people. We can't just be, one thing. We can't be happy and, not move our body all the time. We can't not move our body and, experience these different emotions. We're just so holistically made, and I think that's a really important part I wanted to acknowledge this evening, is that, yes, it's really great to be happy. And at the same time, we also need these situations, events, whatever it is, to kind of check ourselves and check our happiness and where we're at that point.
Thank you, Emily.
Thank you.
Appreciative of all of your thoughts. And good luck as you start your career here at Midland.
Thank you. Thank you
Sounds
very
like
much.
an exciting time for you. Phil,
Okay.
your turn.
Here we are.
Tell us, Phil, you told me you had kind of gave me a set of principles that keep you
Right,
positive
right.
and optimistic. Do you want to kind of share that with us and maybe a couple of stories that go along?
Sure, yeah. I think, you asked me to come on board, not just from the standpoint of a physiotherapist and being active, but also how do you stay motivated? 33.
Oh, I want the audience to know that this was a contest. I went out and asked several people who was the most optimistic person they had met in the last while. And that's why Phil's here. So take it away.
Thank you. Thank you. And
Let me turn up
thank you
the
to
heat
those
on.
who voted for me as well.
Let me turn up the heat a little, Phil.
Thank you. So I think, for me, it's how do I get up and go to the work? Well, first of all, I go to the gym. I don't want to go to the gym. I don't want to get out of bed. I love my bed. I love sleeping. But I know that that's my time that I need to go. So I've trained myself. I need to get out of bed in the morning. One of the latest things I've got is one of the sun lamps, right? So I put a sun lamp beside my bed, and that creates that daylight effect. It starts about half an hour before I want to get up so that the light is coming through my eyelids. My body then feels that, oh, it's sunrise, and I'm not abruptly awaken out of this beautiful sleep by my alarm going off. And I found that is actually very helpful to at least start the day on a positive note, and then I'm off to the gym. And I go to the gym. I know all the technical things that are going to happen at the gym, but I go there with a purpose that I'm going to engage with some beautiful people at the gym. We're going to encourage each other. We're going to make milestones, whatever those milestones are. And that becomes a very encouraging and very enlightening experience. And we have music, and we move our bodies, and it's just a wonderful thing. It also combines sadness that I didn't beat my best friend, pain, physical pain, emotional pain, and all those things culminate together. I realize too that the physical aspect of exercise is so important in our lives to get blood to our brains, the neuroplasticity, especially as we age, to work on the muscles around our joints to maintain muscular control. Medicine's going to keep us alive for longer and longer as we get older. Medicine is advancing, but you still need to keep your body moving. And I say motion is lotion. You need to move. I tell my patients this every day. When I arrive at work, I arrive with purpose, with intent, and I have that moment in my truck. I might call my mom, talk to her, and then I'm at work, and I walk in. The first thing I do is smile, because smile sets my intent for the day, and my staff smile back. My patients smile back to me. I also realize, and one of my staff members pointed this out to me today, was, Phil, you as a boss, you realize that on any given day, not everyone is operating at 100%. Somebody's at 60, 75, somebody's at 90. But you expect 100% of that 60%. You expect us to perform at the best of our ability on any given day, especially in healthcare, given the light of what we've just gone through and are coming out of it. There's still challenges, right? There's still challenges in the workforce, economically, and with our families. And I just find that at work, I love going to work. And why do I love going to work? Because I love helping people. And it really motivates me to see a person smile, to show them that they've got functional movement. I'd like to see you squat. I can't squat. Did you sit on the toilet today? I actually did. Good, you squatted once. Let's see you sit on a chair. Good, you've squatted twice. Now let's go out into the gym. I'm going to teach you how to squat 10 times off a chair. We're making milestones. We're showing people that they can achieve goals. The other thing is, I laugh at work. We make light of situations, support the challenges, and celebrate the successes, right? It's just so important with our clients and with our staff as well to celebrate things. I have a whiteboard in the back, and everyone is always congratulating people on things that happen in their lives, and it makes it for a very, very safe environment to go to. So I love going to work. Am I getting tired? Yes, I'm getting tired as I get older, but I don't see myself changing from that aspect. And then there's the whole, you talked to me about staying physical and staying active. So I support myself with great people. I stay physically active. I challenge myself with stressful environments, especially athletically and competitively.
I want people to know how you really challenge that body. Like these extreme races that you did,
Yeah.
which to me are the survival kind of thing. But give us an example, Phil.
Yeah, so on and off over years, we've been doing these adventure races. So it's basically, it's a race in nature. It's in the bush, and it usually involves 3 disciplines of a mountain bike, a canoe, and your legs. And it's all a map and a compass, usually over a 24-hour period, no rest, 3 or 4 team members. So one, you support yourself with great people. Not necessarily the fastest, the most athletic, the strongest people, but the people you can trust. The people that will be positive, the people that will confide in you about things in your life as you're going through that journey. When you're cold and you're tired and you're hungry and you've been going for 23 hours, you need people around you who can support you and pull you out of that moment that you just want to crawl up in a ball and cry. And it doesn't happen in just these athletic endeavors. It happens in life. So I use these things as a vehicle, as a means to train myself to say, hey, you went through that. You can get through this situation. You can get through, a difficult situation in life just as you have before. So it trains the brain, trains my physiology to maintain high energy levels as well. And we just love doing it. Yeah.
Great.
Yeah.
Great story. Tell me, do you get this great enjoyment of getting in bed in the morning and going and training, but also when you do the finish line, you're pretty pumped too, right?
Yeah.
Well,
Yeah.
Is it equal or is it different or what's it like?
Well, first of all, I don't get great enjoyment about getting out of bed. I'm not super motivated. I'm not a good person to talk to first thing in the morning when I walk into the gym. But, halfway through, once I've got things warmed up and moving, yeah, I can be a pretty fun person to be with and whatnot. And sorry, what was the second part about finishing?
So getting across the finish line.
Right.
Is that feeling different when you get to the finish line, or you just collapse and you don't think anymore?
No, it's whatever that finish line is. It's euphoric. It's that sense of accomplishment, and it's also congratulating those around you, which I think is very, very important because even though you don't get the W, you don't get the win. If you complete the task, it's just it's something to celebrate for everyone and celebrate with people, right? So. And that's what I enjoy, whether it's even just finishing a 6-minute workout at the gym with a group of people. You're there and you're moving your body and you're listening to great music, and then you're celebrating, you're high-fiving everyone at the end. That sets you up for a fantastic day.
So
Yeah.
similar to Kelly talking about with her family and the people that you meet and the gigs that you do, it's just the people around you. That's the thing that really works for you in terms of feeling good about it. That's great. So, Emily, your art is kind of solo. I mean, I don't think many artists do group art. So how does that work?
That's a good point. I think it can go in 2 ways. The way of for other people enjoying it, or for kind of the group, it's the experience that people have by looking at it. Or, sometimes I go to little craft shows and I'll have my art up and they say, oh, how long did that take you? Or, what kind of style is this? It's that engaging of people. They don't have to be doing the art, but they're still interested in the process of it, the experience of it.
So it's not just the painting, the physical painting.
Exactly,
Wow.
right? Yeah. And on the other hand, in that solo practice, again, that aspect of flow, I think it's like for me, it's an intense experience of mindfulness and meditation. You can just be in your moment. You're not worrying about anything else. Sometimes you don't really recognize you're in that state until you're out of it. Sometimes I'll be doing a painting. I'll start, at 11 o'clock at night, and all of a sudden it's 3 a.m. You don't know. It's just that experience of being in something that is so interesting and so intriguing and gives you joy, gives you that happiness, gives you that grounding feeling. Don't have to worry about things going on outside. It's just me and my art and my paints.
Okay, great. Phil, are you done? Because I want to have a little intermission. Is this a good time to break?
Sure.
Okay.
Absolutely, yeah.
So during the intermission, I would like to say a real big thank you to our 7 sponsors. I think Josh and Glenn, you have slides to put up to name those sponsors, and I'll do them in kind of the order of which they've been sponsors for the Our Health program. So Audio Hearing Aid Center has been with us for several years. Georgian Bay General Hospital, longtime supporter. The Center for Psychology and Emotional Regulation, headed by Anita Federici, again, an early sponsor and an early active member, actually, of the advisory committee at one point, Anita was. Hillcrest Village Care Center, long-term care home managed by the Enns family. Mink Insurance, led by David Mink, now known as McDougall Insurance. Lois Lipton, she's got a new company. She's still the same Lois Lipton. New company is Georgian North Real Estate Limited, but they provide commercial real estate and development services in Simcoe County. And we're glad to welcome Waypoint Center for Mental Health Care as our newest sponsor. So I want a big round of applause for those 7 sponsors. Thank you. Our next program, I think there's a slide that goes with this, is on Wednesday, December the 14th at 7:30 p.m. That is exactly 7 weeks tonight, for those of you who remember things better by numbers. And we are pleased to welcome a very dynamic and powerful leader from the Ontario Medical Association, and currently their president. And that person is Rose Zacharias. So what's so special about Rose? First of all, she is a family doctor in this area. She's been living in this area for about 20 years. She works now as a hospitalist at Waypoint. She has worked as a hospitalist at Aurelia, and I still think she does some emergency work, so she's well-grounded in her clinical background. But for the last 8 months, she's been traveling Ontario, listening to doctors and patients about the current health care. She's got some ideas about what it should look like. So it'll be interesting, I've seen the ideas, but it'll be interesting to hear what feedback she's had from the visits she's made. She, in addition to being a doctor and a leader, she's also a busy mother, and she's helping with her busy husband, Rob Meter, who's been on the program before, to look after 4 wonderful children. So we're going to find out how she does it all. And to help me do that, there's going to be 2 or 3 speakers on the stage that use healthcare a lot or had good experience with it, and are going to help me ask those difficult questions of Rose and what her projections are for the future. So a very different format than we've had previously, but I'm looking forward to that program. Before I quit on the advertisement, the blood donor clinic here at the Midland Cultural Center on Saturday, December the 3rd from 9 a.m. to 1 p.m. And a note here to build up your immune system, get your bivalent COVID booster now. Anytime now is good. Anytime yesterday is even better. And you know what? You can even get your flu shot at the same time. So now's the time to boost that immunity and help us all. Thank you. So I've got a couple of more questions here. Can I ask some of our panel and jump in? They sent me something at the last minute here today. They wondered why there wasn't a religious leader on the panel. Please comment on the relationship between happiness and an individual's affiliation with a religion or the faith-based community. So I can answer why we didn't have person, a religious leader on the panel. Honestly, I didn't think about it. So I'll take acknowledge that, and maybe if this person had contacted me before, I might have put it different. We could always add a fifth chair in here. But anyway, what about religion and faith-based in terms of happiness and promoting, helping people with happiness? Any volunteers to take that one? Kelly, I'm looking at you.
Sure. Well, I actually don't practice any religion or spiritual faith. That being said, from people that I know, even clients that I've worked with, I know that their spiritual practice can bring a lot of happiness to them. So that's really what comes to mind first and foremost, is that, yes, I think there probably is an important relationship for people who practice a faith or a spiritual, have a spiritual practice. But beyond that, I'm not quite sure how to comment. But I do think that's a great question.
Anybody have any other comments on it? So did I ask it?
I think I could touch on it maybe a little bit. Again, I don't necessarily affiliate with myself with any sort of religion. I do have an indigenous culture. I also have Polish culture on my side. And I think that generally speaking, it's the values that are important, right? The values that lead that culture or that religion. Oftentimes when we follow those values, we can find happiness because those are the ways that we live by. Kind of related to that, I think, when I think of all the different cultures and religions, and I've had experience in many different cultures and religions, the one common denominator is community and connection. For example, in indigenous culture, we gather for meals, and for a powwow, for example, we celebrate our togetherness and our culture. I was in Tanzania for a little while, and just the community coming together to give thanks, and for us, being there and being able to learn about their culture. Being in India, I experienced some of the culture there as well, the connection between people and gathering. So everywhere I've gone, everywhere I see, I think connection is really important. So within religion or within culture, I think it's important to recognize that happiness can be found with connection with people.
This next question takes a little bit different angle. Just lost my... Okay, give us some pointers how best to work and live with a coworker or a family member who's often pessimistic and negative. Bill?
Well, I can take that from the context of working with clients is just again focus on. I change it to objectivity. What has happened that is good here in this moment. Be in the moment right now, and let's look and see what we can find that's good in this moment, and try to redirect, and focus on that, and then train that my interactions are going to be involving something that is not negative necessarily. I allow you to vent, but now we're going to refocus and redirect.
Okay. Do you have some staff that kind of fit into that category sometimes, and how do you handle it?
That's an interesting one. I mean, one thing that comes to my mind is just, the reality that a lot of people are suffering right now, and it feels like the collective need exceeds the collective ability to give sometimes, and so I think those moments can be challenging because, people are kind of just, trying to get through the day, right? And so that could be hard. I think when we can, channel our empathy and compassion and, efforts to try to be helpful to someone who's going through something tough and is expressing that, that's always helpful, but I do sympathize with and resonate with the concept of kind of compartmentalizing a bit as well, and just protecting the ability to kind of be productive and introduce a different narrative and kind of not get into the dwelling. That's my very unscientific approach.
Okay, but I think,
like it.
as we said before, we can't just think life is wonderful, everything's wonderful. Well, there is pain and there is grief. And there are people who, unfortunately, at times aren't so positive. There's probably all kinds of reasons in behind that are worthwhile listening to at times, but I think it's worthwhile to recognize that. I did have some questions around courage and curiosity and bravery, but I think I've kind of exhausted my time. So at this point, I think I'll stop and I'll say my thanks to all of you wonderful speakers. I first of all want to say thank you to our audience on TV and online. It's been great to be here. We've missed your physical presence, but we know that you're watching us, so that's great. I'll wave to you, okay? We'll see you again in 7 weeks on December the 14th, an opportunity to hear assessment of the current healthcare and to look ahead at what's planned, and questions and comments from local healthcare users will be an added bonus to that program. My big pleasure at this point is to thank our speakers, all of you. I don't think going in tonight I knew what to quite expect. Maybe you didn't either, did you? No, okay. But I think you captured happiness. I think you realistically told us what it's all about, what it feels like at work, what it feels like with your friends, what it feels like for you personally. And so thanks for sharing your personal stories. I realize I delved a little into personal stories that I don't normally do, but I really appreciate the fact that you shared them. Nadia, as always, you are kind and you're so thoughtful. Perk is the thing that we should remember, right? Mm-hmm. And so thanks for your ideas on that. And I think we'd like you to have you back sometime and find out how this all worked out, Nadia. And personally, how you all worked out, how it all worked out.
Yeah, my pleasure.
Got some big shoes to fill and lots of work to do. So thank you for your time.
It's a grand adventure. Thanks.
Kelly, you really celebrated music. When you said you were going to play, I had no idea that it would make me feel as good as it did. The entire evening of my evening is predicated on just listening to your music. So that was a wonderful experience, and I know our audience enjoyed it just as much as I did. So thank you as you continue your career in music, and as a music therapist, you have so many things to give to people, and I'm sure that makes you happy too. So thank you.
Much appreciated. Thank you.
Emily, you've brought us a new perspective on art and culture. You really have. We've never had an Indigenous speaker here before, and that's my fault again, but I appreciate your frankness and the discussion you had. It was from a very different direction than we heard before, and so thanks for making yourself available, and I hope that new house gets built, and I wish you every success at your new job, and it's great to have you here.
Thank you. Thank you very much.
And Phil, as usual, energy, but it's not just the energy that impresses me, Phil. When I walk into your office, when I visit you, when I see you on the street, it's that contented look you have on your face. It's a kind of that quirky little smile, but inside, you just feel as though there's a guy who's just kind of happy.
Yeah, I'm pretty happy.
Yeah.
Yeah.
So thank you for showing us that tonight, Phil. We
My
really
pleasure.
appreciate you being here.
Yeah,
Thanks a
pleasure.
lot.
Thank you.
And of course, to our 7 sponsors, thank you again. Take the opportunity to watch the program again or recommend it to your friends. We view it on Rogers about 10 times a week. You just need to find out where it is. And it'll, of course, be available on demand and online. And just need to go to the Midland Cultural website, the Our Health website, and you can find out the link to that show that we've got. So again, thanks to all of you. Enjoy the rest of the evening, and good night to our audience.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
It was our 35th anniversary. To celebrate, we were on our way to Mama Rosie's, where we had our first date. That's when we heard coming from the radio. So we stopped and listened. It helped us get to safety. So when I think of our anniversary, because now we have even more to celebrate.
Watching hockey just got a power play with NHL Center Ice and Super Sports Pack. With up to 37 out-of-market NHL games a week, you'll always catch your favorite team no matter where you live. Whether it's big matchups you're looking for or following your top fantasy picks, it's all here. NHL Center Ice, part of the Rogers Super Sports Pack. All this for only $35.95 a month. Order through your remote on Channel 450 or call 1-888-ROGERS-1 today.